Rare and fast growing. Certainly not the words you want to hear with a cancer diagnosis. Good morning. I'm Jessica Lovell. It's Monday. Welcome to the Morning Medical Update. CAR T-cell therapy is relatively new and already saving the lives of cancer patients. Darren McLaughlin knows that firsthand. Back in 2019, he learned that he had an aggressive form of lymphoma. Chemotherapy helped, but his tumor continued to grow. Doctors told him his best bet was the University of Kansas Cancer Center, where specialists have access to more treatment options. And we are so happy to have Darren with us this morning. Good morning. How are you?
Hey, how about yourself?
Great. Well, if you're watching, you might recognize his face. He, as the chief of police in Merriam, Kansas. We've had you on some of our programs in the past, so it's so nice to have you back here with us. We're also joined by his doctor, Dr. Joseph McGuirk. Dr. McGuirk is the medical director of the Blood and Marrow Transplant Program at the University of Kansas Cancer Center. How are you?
Doing very well. Thank you, Jess. How are you?
Good. Good to have you. Good to have you and Darren back together.
Yes,
nice to see him.
Absolutely. It's miraculous.
It always is, and we're going to hear much more about your story. Darren, you told us that this all started with some severe back pain. We know a lot of people have back pain. How long did that last until you decided you got to go see a doctor?
It lasted from about the fall of 2018 to January of 2019. It was, I had made excuses as to why I was having the back pain. I was moving stuff to a storage unit. We were building a new house, and so I just chalked it up to I was straining my back, and we were progressing medically with that diagnosis, pain management and things like that. And then in January of 2019, it got so bad that I was at work, and I told them they had to take me to the emergency room because the pain was just getting too bad.
Good call on going to the ER, but you eventually learned you have cancer, and then you started treatment at another hospital. That's correct, right?
Correct. Yeah.
So what led you here to the? Oh, go ahead, please.
Yeah, I started treatment at the hospital I went to the emergency room at, and did a couple rounds of traditional chemotherapy for the non-Hodgkin's lymphoma I was diagnosed with.
So what was it like when you heard, Darren, that you had cancer?
Well, it's a shock to everybody. You go in thinking you just had a bulging disc or something that was causing the back pains, and come to find out, you had stage 4 non-Hodgkin's lymphoma, and so that was a shocking day.
And you were ready to take it head on. What led you to the University of Kansas Cancer Center?
After my second round of chemo, my doctor, who was treating me, just basically told us that there was nothing more they could do for me, and that she had reached out to Dr. McGuirk at KU about my case, because she knew that KU had different forms of treatment that she thought I could benefit from, and so that's how that happened. And Dr. McGuirk was able to take my case, and I was immediately transferred over to KU, and the rest is history.
And what was it like when you met Dr. McGuirk for the first time?
Oh, I knew I was going to be okay. I've said this to Dr. McGuirk before, as passionate as he is about the form of treatment, eventually CAR T, which I received, and his ability to explain things, and I just knew right then and there that if there was anybody that was going to be able to help me, it certainly was going to be him and KU.
Yeah, he has a knack. Him and his bow tie. Walk in, you have this knack, Dr. McGuirk, of making people feel really comfortable and that you've got this. So you meet Darren for the first time. Tell us about what you knew about his diagnosis, and did that change once you kind of dove in and decided what his treatment plan was going to be?
Yes, it certainly did. Initially, and understandably, at the outside hospital, he was diagnosed with an entity called Burkitt's lymphoma. And there's a similar overlap with a high-grade B-cell lymphoma. They're very, very similarly treated and have similar prognosis, long-term outcomes. But once patients receive chemotherapy and are no longer responding, that patient's in a boatload of trouble. Historically, a few options. Try other types of chemotherapy, try to get to a stem cell transplant, and we could save about 35% of patients. CAR T-cell therapy, leveraging our knowledge of the immune system and how it functions, and manipulating that immune system to the advantage of our patient against our cancer really has come to the forefront in the last decade in particular. And so we were doing at the time a remarkable therapy called CAR T-cell therapy, which was brand new, fresh out of the blocks. Based on the preliminary results and studies that we had performed here at University of Kansas and other centers around the nation, thought that we had a good shot here. And so we needed to get him treated. We needed to get him treated quickly because his disease was behaving very aggressively and growing rapidly. And he wasn't looking so great when he came over to see us.
So you knew there was work to do. So this brand new CAR T therapy is called Yescarta. I'm going to let you pronounce it. I don't pronounce big words on Monday morning without like 3 cups of coffee. So you go for it. Tell us what it is.
Axicabtagene ciloleucel is a CAR T therapy which actually, as I mentioned, leverages our better understanding of how the immune system works and what goes wrong when it doesn't work, and allows patients to develop cancers in the first place. Taking patients like Chief McLaughlin's blood and isolating cells called T cells, which are the conductors of the orchestra in the immune system, but they're dysfunctional, and they should have prevented him from developing that cancer in the first place, but they failed for a number of complex reasons. So we take those T cells out, we take them to the laboratory, and genetically re-engineer them to recognize the cancer again, expand them into 1 billion cells, and then a couple weeks later, infuse them like a blood transfusion into the patient. They sweep around the body, identify cancer cells, attach to them, punch holes in them, and release molecules that go in and chop up the chromosomes inside of the cell. And that demonstrated unprecedented responses and complete remissions and durable complete remissions, which you're going to hear about in the New England Journal of Medicine again later this week, and a manuscript that we co-authored here at University of Kansas. And with results like that, which Chief McLaughlin has experienced, complete remission, this thing is far in his rearview mirror and will never catch up with him again. He's got to stay out there for a few more decades looking out for the rest of us.
Love that. So how many different types of CAR T therapy are there? Because how would you know that this particular therapy would work for Darren in his case?
At the time, there were really only 2 types of CAR T cell therapy for the type of lymphoma that Chief McLaughlin was dealing with. Now there are a broad array of CAR T cell therapies that are used in a number of non-Hodgkin's lymphomas and in multiple myeloma, in acute lymphoblastic leukemia in children and adults, and it's rapidly expanding. If you just look at our own program, we are doubling and tripling the number of CAR T cell therapies that we're employing on a yearly basis, both in the context of clinical trials, but also FDA-approved, commercially available constructs for patients like Chief McLaughlin. We also are expanding into solid tumors now and have a number of studies at our center looking at far advanced solid tumors such as colon cancer and ovarian cancer, breast cancer, lung cancer, etc. So it's a really remarkable time. We're going to see this explosively grow in the next 5 to 10 years.
So, Chief, what was it like when Dr. McGuirk presented a trial opportunity to you? Was that part of the trial that he was in, this Zuma 7?
I believe, Chief McLaughlin, were you on the Zuma 7 trial?
I don't believe so. I believe my understanding was the FDA had just approved on a limited basis this.
That's right.
This treatment. According to what you were telling me, so this wasn't really part of a trial. It was just the beginning of actually approved treatment by the FDA.
Of the approval state.
Yes.
Tell us a little bit about how that works, how it can be limited approval before it becomes full FDA approved.
Critically important. So the initial study that we conducted in the United States for CAR T cell therapy, like that which Chief McLaughlin received, were patients in the 3rd line who had failed multiple prior therapies. And so that received FDA approval of 2 different constructs, one called Tesogen and the other called Axicel, which is the one that Chief McLaughlin received. Once we were able to demonstrate that it was effective in the worst case scenario like Chief McLaughlin's, don't mean to scare you there, Chief, but this is behind you once again. Once you demonstrate that you can get patients in complete remission, durable complete remissions, and curative therapy Then the question was, well, why allow patients to wait that long? Why not move it earlier in the disease process? And so that's what we did with the ZUMA-7 trial, which will be published later this week in the New England Journal of Medicine, demonstrating that if you moved it and challenged stem cell transplant, which we had been doing for 35 years in patients with high-risk large cell lymphomas, challenge that paradigm and see if CAR T was better, and CAR T cell therapy indeed was better. Because it's embargoed until the release of the study later this week, I can't discuss that in this venue, but you'll hear about it in a relatively short order, what those results look like.
And how important has it been that these types of therapies and treatments, it's like game-changing to be able to get them to patients sooner rather than last line of defense?
Absolutely. So we historically were seeing in patients with relapsed refractory large cell lymphoma complete response rates of 7%. In our early trials, we were seeing complete responses of 50%, overall responses of 80% in some of the clinical trials. Total game changer, paradigm shift, and now CAR T has replaced autologous stem cell transplant as a frontline therapy for the highest risk patients.
So, Chief, tell us how your health has been since you received this CAR T therapy. How are you doing? Are you back to work, back to being you?
I am back to work. I received my CAR T in August, and just to give you an idea how quick the turnaround is, and I was back to work in September. I was actually made chief September of that year. So since then, I have been cancer-free. I just actually completed my 4-year scan, and it came back no cancer. I am healthy. I do have a little bit of an immune deficiency, and I have to receive IVIGs to help me with that monthly. But other than that, I'm as good as I was prior to the cancer. So, yeah, everything's really good.
So is it fair to say that CAR T therapy was a little easier go than chemo? Can you compare the two? What was similar? The good, the bad, the ugly?
Yeah, I believe, the chemo, hits you for a little bit longer, the side effects of the chemo. I remember the side effects of the CAR T treatment. It was pretty intense for the first 48 hours. But once I got through those side effects, I really didn't have any lasting side effects that bothered me. So you get through that first 48, 72 hours with the CAR T, and things are pretty good.
So what will the follow-up continue to be through the years?
Every year for the rest of his life in our program, but the Food and Drug Administration requires that we follow patients for a minimum of 15 years. And the reason for that is we're genetically modifying these cells. And there are potential theoretical risk of late effects of these genetic modifications. We haven't seen any of that with the CAR T cell therapy to date, and we've been at this for over a decade now. However, because of the theoretical possibilities of late effects, we have to keep an eye on our patients for many years. And
you say with certainty this is behind Chief McLaughlin, but we hear the words cancer-free and remission or no evidence of disease. Help us understand a little bit between why we feel so good that this is behind him.
Most patients with this type of aggressive lymphoma who are going to relapse are going to do it in the first 1 to 2 years after receiving their treatment. With CAR T cell therapy, most patients with these aggressive diseases who are going to relapse will show us that in the first 6 to 12 months. Not everybody has a complete response up front. Not everybody who has a complete response is cured of their disease. However, about 40 to 45% of patients are long-term relapse-free survivors beyond 5 years. Now, that's not good enough, but that's a lot better than practically none prior to the development of CAR T cell therapy. However, it does require that we continue to conduct clinical trials like that which led us to the therapy that Chief McLaughlin received. New therapies, building on what we've learned, our advances. So it's not 40%. Next year it's 60%. The next year it's 70%, and so on until we conquer all of these cancers.
Right. That's what gets you up in the morning, doesn't it?
You betcha.
I know. Okay, so this is pretty fun. Dr. McGuirk, you nominated Darren for the Buck O'Neill honoree seat at the Blood Cancer Awareness Day at the K, which is coming up on July 14th. So what made you pick this guy?
Well, he's just a great guy in general. He has had a fantastic course, and very importantly, with these new tools, we're able to save Chief McLaughlin's life, so Chief McLaughlin could go out there and use his troops to keep us safe and keep us out of the emergency room, protecting us in so many different ways. So he, completely independent of having conquered this cancer, is an extraordinarily successful an important person of our community. All people are important. Chief McLaughlin is right out there in front of all of us.
He fans out.
He sure does.
Reaches many, many people in our community and beyond. So, Chief, what was it like? That was quite an honor for Dr. McGuirk to nominate you. What was it like when you got the news?
I'm thrilled. I mean, I am honored, and I also thank the KU and Dr. McGuirk for, one, saving my life, and two, I've been very blessed to be able to advocate on behalf of cancer survivors for the great work that Dr. McGuirk and KU have and are doing, and talk about the future of cancer treatment. So I appreciate that, and I'm very honored. And if I've always told Dr. McGuirk and everybody that I'm available to help tell my story so that it can make a difference for other people.
Another reason why he's got to stay out there.
Absolutely.
Out there and about there. Okay, if you have questions for any of our guests today, you can use the chat on YouTube, Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's get a quick check of our COVID count. Dr. Dana Hawkinson on this Monday. How are you?
Hi, doing good.
Hey, what's going on?
It's a nice day out today. It's good here at the health system as well for active patients for COVID-19. We have 18 total, but only 8 active, still 1 in the ICU and 1 on the ventilator. We had a question and concern about, are we still tracking vaccines? We are. This all is pretty much had to be done by hand. I don't have those updated information statistics just right now. However, we should also note that, again, most of these patients that are here really have those other comorbid conditions, such as older age, but also things like blood cancers, solid organ cancers, or chemotherapy or immunosuppression for other reasons as well.
So also, Doc Hawk, we want to get your thoughts on a recent study looking at how COVID impacted school attendance. We already know COVID vaccination rates among children are very low. The study published by JAMA estimated that if kids got vaccinated for COVID at the same level that they got the flu vaccine last winter, we could have prevented more than 5 million days, 5 million days of school absences for our kids. So, Hawk, when should kids get the COVID booster shot?
Yeah, again, I think we are waiting on the recommendations that will probably be coming out here in the next couple months, looking ahead to the fall and the winter in those cold months. So we will wait and see exactly what the recommendations will be and what the vaccine makeup will be as well. Certainly for older people, again, those people that I had just talked about, older age, but also comorbid conditions, it's going to be very important probably to get another booster here before the cold winter months. But I know that the CDC is meeting and the advisory group is meeting probably in the middle of June here. So we will kind of wait for some of those recommendations. It is vitally important, not only for COVID vaccines, but I think we need to address childhood vaccines in general. And it's vitally important to continue to have those high rates of childhood vaccines, those things that get like measles and mumps, rubella. Obviously HPV, we know the HPV vaccine uptake is very low here in our states, Missouri and Kansas, so we need to increase that uptake. Those will help prevent other morbidity and mortality for those young children as well. So it's not just the COVID vaccines that we need to be promoting, it's those other childhood vaccines as well.
Hawk, thanks so much. Do we have any reporters with us today? Let's get to our community questions. All right, Lynn wants to know, what questions should you ask when first diagnosed with cancer to make sure that you're at a hospital that can provide the best treatments for you?
Absolutely, critically important question. One of the first and foremost questions to ask is, are there clinical trials available for my circumstance? We consider clinical trials a frontline, state-of-the-art therapeutic option for patients, and we seek to have a clinical trial available for every patient with cancer who comes to our center. None of our therapies are completely optimized too often, despite all of our efforts, and most importantly, our patient and their family efforts, patients have significant toxicities, and not everyone goes into remission, and not everyone who goes into remission is cured of their disease. Until those things are no longer the case, and we have maximal effectiveness and minimal toxicity, our job is never done. And the job that we do is through conduct of clinical trials. Now, of course, not everybody's eligible for a clinical trial, and we don't have a clinical trial for everyone who comes here, although we have a very robust clinical trial profile. So many folks, like Chief McLaughlin, receive state-of-the-art cutting-edge therapy. And I think the most important thing patients and their families should do when they have such a diagnosis of cancer in general is educate themselves, inform themselves, look at legitimate sites online, cancer centers like our own and NCI-designated comprehensive cancer centers, which will be very informative, and learn as much as you can, and that will help you ask really good questions and get proper answers to those questions.
Chief, Pauline wants to know, did your cancer diagnosis affect your work as a chief? I'm sure you had immense support around you, but did it hold you back at all?
It did not. Obviously, I missed a amount of time to deal with the treatments, but and I wasn't chief when I got diagnosed. I was actually the assistant chief. My chief retired in the middle of my cancer treatment. My city, the city of Merriam, stood by me, kept my position open for me, waited for me to get better before promoting me to chief. They could have easily gone outside and filled that spot, not knowing what was going to happen, but they had enough faith that in me that they waited for me, which was great. I'm happy to be back and serving in the role of chief right now. So, everything worked out.
That says a lot about the city of Merriam, but even more so about you and the kind of guy you are. So we're great. You get rid of cancer, and then you get this new promotion that you so well deserved. Teresa wants to know, is back pain a typical symptom of this particular type of cancer?
Not necessarily. It depends on where the cancer occurs. The type of cancer, the type of non-Hodgkin's lymphoma that Chief McLaughlin had can present really anywhere. It can present in the central nervous system, in lymph nodes most commonly, in the spleen, in the liver, in the abdomen and pelvis. And the symptoms that patients present with are completely dependent on where this occurs. Is it pushing up against nerves? Is it pushing up against a major organ, et cetera?
Makes sense. Jean wants to know, is CAR T therapy being used for prostate cancer?
Yes, absolutely. It certainly is. So there are a number of trials in the United States currently underway, including at our own center, exploring in advanced prostate cancer a cell therapy that recognizes a specific molecule called PMSA that is produced by the prostate cancer cells and is expressed on their surface so that the cells can attack them. Prostate cancer is a very important focus of cell therapy currently.
Yan Liang wants to know, could CAR T therapy possibly lead to autoimmune diseases?
That's a very thoughtful question. Actually, the flip side is the case. Autoimmune diseases are often caused by a population of cells called B cells. And CAR T-cell therapy have been developed to treat autoimmune diseases like severe rheumatoid arthritis, systemic lupus, scleroderma, a number of diseases. Multiple sclerosis cell therapy is being explored currently. So while theoretically, in some ways, cell therapy could potentially lead to autoimmune diseases, we're using it against autoimmune diseases.
Gotcha. Okay. So I want to ask what our takeaways are today, and I want to start with you, Dr. McGuirk. What do you want folks to take away from this conversation today? We know it's Cancer Survivor Month, so
yes, absolutely.
We love to celebrate that. That's
right. It's an extraordinarily hopeful time. The therapies that we have today represent a revolution in cancer therapeutics. If you're diagnosed with a cancer, a family or a friend, get to a top-flight cancer center such as University of Kansas. an NCI designated comprehensive cancer center, they will have the most broad array of clinical trials available, and if they don't have a clinical trial for a patient, they can look around the country, as our team often does, and find a clinical trial available for our patients. Also, educational resources are second to none in an NCI designated cancer center. So be hopeful, be determined, and educate yourself about your cancer.
All of us get excited about different things, and this must be just such a really exciting time for you right now.
It's the most exciting time of my entire career. I've always been enthusiastic and optimistic, and very energetic. I love the science. I certainly love the patients and their families and being able to spend time with them, especially during the most trying time of their life often. But never have I been as excited and as optimistic as I am today, many years after the start of my career.
What do you daydream about happening when it comes to these type of therapies as far as the end game? What would you really love to see?
Beating all of these rotten diseases.
Fair enough. All right, let's get our takeaway from Darren. Again, June, National Cancer Survivor Month, and that's exactly what you are, Chief. And we're just so glad you are with us today sharing your story. What do you want folks to know and take away from your story?
It's just don't ever lose hope. Trust your doctors, but advocate for yourself. That's one of the things that probably waited too long to be seen for other than just back pain. I knew something wasn't right, but I didn't really advocate in the way I probably should have at the beginning. But in the end, trust your doctors, but educate yourself in what they're telling you. And hopefully you have a strong network around you like I did with family, friends, and everybody else that made the whole experience. It's not good, but made it definitely something that you can get through in the end. And here I am today, 4 years later.
Yeah.
Couldn't have asked for anything more.
Yeah, here you are. And that's the whole point of having you on today. Someone's going to hear your story and know something isn't right and go get it checked out and get their life saved. So thank you so much. Stay in touch. Be well. Thank you to both of our guests today and all of our viewers. As always, go out and make it a great day.
It's an unusual form of chemotherapy, heating the drugs and pumping them into your belly. I'm Alexis Del Cid. On the next Open Mics with Dr. Stites, a new edition of Show Me the Science exploring HIPAC, a treatment some doctors doubt. We break down the evidence showing it works for certain patients. Wednesday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.